Please welcome Marcel Dürpes, Flix founders.
Hello everyone, this is Marcel, the investment manager of Flix Founders, and today I would like to introduce you to our portfolio company, Mallia Therapeutics. Imagine up to 33% of our female and even up to 85% of our male global population is experiencing problems with hair loss at least once throughout their lives. As you might know, solutions are often costly, painful, have unwanted side effects, and overall are not satisfying. This is where Mallia comes into play. Founded by Manfred and Alexander, they have discovered a molecule that can fix all of these problems. Here to tell you more, we are firm believers that they deserve this year's Breakthrough Award, Falling Walls.
Breaking the wall of hair loss through immune modulation. Alexander Steinkasserer, Mallia Therapeutics.
So, welcome back after the lunch. I'm happy that you are present today. So let me start with the introduction of our company and the problem we want to solve. And this is the problem, the wall of hair loss. And 65% of people, men, over 60 suffer from this problem, but also women over the age of 70, 50% of them suffer from hair loss. What is the reason for hair loss? It's a degradation product of testosterone, the hormone, which destroys the hair follicle, and this then starts the process of finally leading to complete hair loss in some cases. Competitors only have products which slow down this process or keep alive those hair which are still present. In addition, they can go along with severe side effects, and therefore there's a huge medical need for new products. And due to this lack of effectiveness and these side products, only 10% of people suffering from hair loss are actually treated. It means 90% are not treated. And in total, 3 billion people suffer from this hair loss problem. So the market size is huge, $24 billion US dollar in 33, and the annual growth rate is about 9%. So what is our solution? We discovered a molecule, it's called soluble CD3. It's an immune modulatory molecule which blocks the process leading to hair loss, activates the growing phase of these hair follicles, and it induces, very importantly, also the production of keratins, which are the building blocks of hair. We have performed already studies in the lab using human hair follicles. You see on the untreated controls, you only see minor signals. It's completely different on the right-hand side, where you see the CD83 treated hair follicles, many molecules and pathway leading to hair growth and activation of the hair follicles are induced. We have already a couple of volunteers which have been treated. Here you see a younger one after 6 months. You see before and afterwards, we indeed induce new hair growth, also in areas where no hair have been before. This is an older one after 12 months, again starting, and after 12 months. Interestingly, in this case, even the color came back. They are black hair again, which is quite something extraordinary. So what is our business model? We have two different models. One is a product for the private use, a B2C event, and we have already the first products on the market. From this Tuesday onwards, our online sale is active, and very nicely to announce that we reached already 100,000 euro figures after 2 days, so the market is really huge. And the second is to develop this as a therapeutic option, and we aim in 27 to have a proof of concept study, phase 1b, 2a, and this will then develop the therapeutic concept. So we also have scalability, and our vision is, I mentioned, we have an immune modulatory molecule, and this molecule also activates regulatory T cells. And I'm sure many of you know that those people which discovered regulatory T cells this year got the Nobel Prize. So this is a very, very important immune cell, and it plays an important role in different autoimmune diseases. We will try to keep or develop new therapies for autoimmunity. Transplant rejection will be inhibited, and also inflammatory skin and eye disorders. The financial situation is like that. Since we funded the company in June 23, we raised 5.6 million. And further development is either based on these revenues generated by the consumer study I just mentioned, introduced this. The alternative or additional pathways to further financing by rapid progress to allow the rapid progress towards clinical development. These are the two options. We have a nice founder team. Manfred Köppel, for instance, he is in the present. He is co-founder of Immunic, which was Nasdaq listed after 3 years. We have a very distinguished advisory board with Jens Holstein, for instance, the former CFO of BioNTech. Alexandra Gilve is a dermatologist, leading dermatologist in Munich. And Ulrich also funded many companies. And this is our international advisory board. Thank you very much for your attention.
Thank you. That was a sales pitch, right? They know how to sell stuff. I want to have it. No, I don't need it. But yeah, it's great. Okay. I mean, it's a great market. So questions. Let's go. Detlef, please.
Thank you. Question, what's in this kit? So this is not in clinical trial approved product. What's it?
This is the cosmetic product we have right now. We all tested, the necessary tests have been performed for a cosmetic product.
Topical application or injection?
Topical application, all topically. And this is the
soluble CD83 as topical.
Correct, yeah. It's in a PBS solution. You just apply it on your bald areas. You massage it a little bit in, and it directly diffuses into hair follicle canal. So right spot on where you want it to have.
Okay, next question will be Andrea, before we go to Andreas.
Yeah, thank you. Question to the mode of action a little bit. You mentioned that you activate the regulatory T cells on the one hand, and you mentioned also that the sensitivity to testosterone is one of the key problems that lead to hair loss. How does that fit together? Because the sensitivity will still be there after having applied your reagent.
So what we found out in our molecular studies that CD83 inhibits apoptosis, which is induced by dihydrotestosterone. So we have anti-apoptotic molecules present. Then we have activation of stem cells, which is very important to prolong the anagen growing phase. And thirdly, we have also upregulation of keratin production, which are the building blocks. In addition, we restore the immune privilege of hair follicles using or inducing regulatory T cells and tissue repair macrophages.
All right. I have a basic question. Why is it a problem to have hair loss? Just kidding.
Best question ever.
But seriously, what's your thinking on pricing? And also, what is the thinking on how the repeat dosage? So how often will the consumers need to use this, and for which time periods?
Yeah. So the benchmarks you have to apply every day or even twice daily. Our product you only apply twice weekly. So this is already a huge advantage. Price-wise, we adapted our prices to the benchmark products before the patents run out. So it's comparable. What was the third one? Why it's a problem. Yeah, well, you know, it takes about 4 to 6 months until you see the first hair coming back. And we have now 3 or 4 volunteers that took it now between 15 and 24 months. Nobody volunteered not to take it anymore, so this question is still open. We guess that maybe at later stages you don't have to take it so often, but you still have to take it because you're right. The reason, which is that the dihydrotestosterone is not gone.
We have a question from Inga. Sorry for the audience. I don't think I will have the time, but let's
Thank
try.
you very much. I would like to understand the difference between the two products. So on the one hand side, you have the consumer one, and on the other side, is it only the approval? And if yes, what does it mean for pricing and focusing and stuff like that?
So we initially thought just to develop a therapeutic product, but we got so many questions and emails and phone calls from people suffering from hair loss it's a problem. And therefore, we decided to also generate a cosmetic product, which is much easier to bring onto the market. Secondly, we have two different products. We have the wild type, let's say, CD83, and the mutant for the therapeutic development. So they are separate. With the therapeutic, we aim to treat people from the allogenetic areata, which is an autoimmune disorder, which needs different treatments, maybe even systemic, might be. And then we also have the option, well developed wound healing.
Yes.
Hard to heal wounds, diabetic wounds.
Okay, thank you very much. I'm so sad to say that we are already beyond the 4 minutes.
No problem.
Don't forget your product.
No,
Otherwise, I'll take it for my father.
perfect.